If you're watching this video, you're probably working with me or one of my colleagues at the clinic, and we're helping you out with some foot, knee, ankle, hip, maybe even low back problem. This video is going to be a detailed description of how to do a sumo style squat with the assistance of some suspension straps, which are often used to make the jump in exertion or force demand a little less when you move from lying down exercises to body weight exercises. If you have the straps to hold a little bit of your body weight, the jump between those two scenarios isn't quite so large, and the likelihood of your body reacting adversely is a little less. So we'll talk a bit about some principles to consider when you're posturing yourself, and then I'll do a minute's worth of repetitions and talk while I'm doing them. So the starting position is going to be your feet wider than your pelvis. So there's my outer borders of my pelvis. The inner borders of my feet are on the outside of that dimension. My foot rotation is going to be 45 degrees, but it doesn't have to be exactly 45 degrees. People have differences in terms of the rotation that feels the best for them. So you start around there and assess how you feel and what feels the most comfortable. So if I go out more than 45 degrees, I'm feeling a little bit of a pull on the front of my groin here. I back off, that goes away. And if I go in further, I feel a little bit of pull on the rear of my hips. So I go the opposite, and I find that happy middle ground. When you're going in from the starting position to the end position, you're endeavoring to preserve your spinal posture as viewed from the side. Your therapist might ask you to do a different posture, but generally you're trying to preserve your starting posture in your spine. So as I descend, if I don't attend to that, what'll happen is my back will go into a rounded posture because the tightness of the tissues around my hips will cause my pelvis to roll backward, and that will have to be accommodated by my spinal change and my spinal posture change. If I'm mindful of keeping my spinal posture the same, what I'll have to do is, as I descend, I'm going to have to stick my stomach out somewhat, stick my chest out somewhat, and make that effort more pronounced the lower that I go. Because the closer you get to the ground, the more effort it's going to take to keep those tissues around your hips from tightening up and pulling your pelvis into a backward rotation and distorting your spinal joints, and you'll end up moving less from your hip joints than you would have otherwise. And the architecture of your hip joint is really well suited to large motion production. The architecture of your spinal joints and your what's called lumbosacral junction is quite complex, great for fine tuning, not great for a lot of mobility production. So let's go through some of the maneuvers. Aside from keeping spinal posture in mind as you descend, always try to keep some effort of increased weight through your heels relative to your forefoot. It causes more useful muscles to participate in the movement. If you get a lot of work going through your forefoot or a lot of weight going through your forefoot, you're probably going to be recruiting your calf muscle, and unless you have a specific rehabilitative issue that requires focus on that muscle, you're probably better off focusing on the distal quadriceps, the proximal hamstrings, and the gluteal groups. Here we go. A little bit of help here for my suspension unit. I'm still in the picture, I'm still in the frame. My arms are going to be in a position where they can generate power easily. If they're way out here, they don't generate power all that great. If my elbows are behind me, they don't generate power all that great. So here, my elbows are just in front of my torso, very slightly, and I can brace my shoulder blades and my arms, and now I have a little bit of help to help me up and down. The spinal posture again, being tall, thinking of your crown of your head, separating from the tip of your tailbone and vice versa, keeps a nice tall posture too. It's another verbal cue. I'm going to set my timer for a minute, and we'll do a minute's worth of repetitions where we're not focused on how many we're doing so much as focusing on what to think about as you're doing the maneuver. As you get better at all these things, the number of repetitions you do and the time set by your therapist is going to spontaneously increase because you're going to know these things with more automatic quality. But at the beginning, It's not likely to be automatic. There's our minute started. I've got my posture described as before, and then down I go. As I descend, I'm thinking of my stomach sticking out through forward, and then I'm going to push up through my heels. And I descend, chest is out, stomach is out, up, pushing through my heels. Okay. Your therapist may want you to activate your gluteals a little bit more, and so they'll tell you to push your knees away from one another as you push up. That's a thing that's useful to do if you want to activate your glutes. On the way down, I've got my knees pushed apart. You can't tell, but I'm making an effort to push my knees apart as I descend and ascend. My pace is such that I'm able to think about the different things that I've been told to think about. Okay, down I go. My belly's sticking out forward. And back up I go. And I didn't accomplish many repetitions, but I'm building my form. And once my form is good, and it comes with a more of an automatic quality, my repetitions can go up, and my biomechanics are going to stay sound, and my joints are going to be happy. Very good. I hope this helps.